Thank you all so much for joining us today. My name is Alice Buffkin. I am the Associate Executive Director of Data and Policy at Citizens Committee for Children. We're so glad you can join us today. This is obviously such a critical time to be learning about and advocating on the state budget issues that directly impact children, families, and communities throughout New York. Today, we're going to be providing a high-level overview of some of CCC's budget priorities for the next fiscal year. These are really the investments that we believe are urgently needed to help children and families thrive in New York. But it's also not a comprehensive overview of all of the investments we believe are needed. Those can be found in our budget priorities document, which is being shared in the chat. But we do want to uplift some key budget recommendations and some ways for you to engage. So we'll kick it over and talk through the agenda for today's webinar. If you could jump to the next page, please. So first, we'll provide a very brief overview of Citizens Committee for Children for those of you unfamiliar with us, and then provide a little bit of policy context to help understand how these priorities fit within the broader political landscape in New York State. Then we'll walk through our highlights of state budget priorities, and then have an opportunity to learn about some options to get involved and take some questions. If you want to jump to the next slide. So about CCC, so we are an organization, a children's advocacy organization that has been around for more than 80 years. We are an independent voice for children and family well-being, and we do our work through a combination of research, advocacy, and civic engagement. We ultimately are trying to champion the kinds of policies and budget investments that are needed to improve child outcomes and promote equity throughout New York City and New York State. And our ultimate mission is to ensure that every New York child is healthy, housed, educated, and safe. And today you'll be hearing from three members of our policy team, myself, our Senior Policy Associate, Caitlin Passaretti, and our Policy Associate, Geneva Lowe's. And if you want to jump to the next page, please. So just to provide a little bit of context for listeners before we dive into the budget priorities, some of you are likely intimately familiar with all three figures up here, the state budget process, where we are, but others may be learning, so we want to take a moment to make sure everyone is on the same page. So in New York State, our state budget is the piece of legislation that ultimately determines how the most important programs and services in the state are funded. It dictates how well the systems it dictates how well the system within our state are equipped to provide New York's individuals and families with the education services, the social services they need, housing supports, all of the elements that are so critical for having a healthy and thriving New York and making sure that children are growing up with a bright future that we want for them. Each year, the budget is negotiated between the governor, the Senate, and the Assembly. In New York, as we all know, our governor currently is Governor Kathy Hochul. Carl Hastie is the Speaker of the Assembly, and Majority Leader Andrea Stewart-Cousins leads the Senate. There are also 63 members of the Senate and 150 members of the Assembly who are all advocating and sort of championing together different priorities within their spaces. And these three individuals here, these state leaders, are really who are at the forefront of budget negotiations. Significant groundwork for budget advocacy really is laid throughout the year. It really starts to heat up in the fall. And then January is when we really see sort of how that advocacy work is playing out in the priorities of our state leaders. So in January is when the governor releases her executive budget, which essentially lays out the version of the state budget the governor is proposing. It includes new investments, sometimes cuts, and a picture of what programs are being proposed to be funded and at what levels. We then enter into a period of budget negotiations and hearings where the public can submit testimony on budget priorities, and that's essentially kind of where we are right now. Then in March, the Senate and Assembly released their own version of the budget, known as the One House Bills. And then from there, budget negotiations continue through March, and the budget for the next fiscal year is supposed to be adopted by April 1st. So, as you can tell, we are very much in the thick of it right now. This is a particularly important period for advocacy. This really is the time to take action, to reach out to the governor, to the Senate, to the Assembly through advocacy days, e-actions, call-in days, visits with local districts. Every effort is really meaningful at this stage, and we'll have some opportunities at the end of how you can engage. And we really encourage you to sign up for our listserv so you can stay up to date on different opportunities to advocate. And the last piece before we dive into budget priorities is I want to just provide a little bit of policy. Yes, I think you can jump to the next slide. Is provide a little bit of policy context to orient us. So the fiscal year executive budget I referenced is set at $260 billion coming from the governor. And there were some major investments that we see in particularly in early care and education. So we saw hundreds of millions of dollars invested in statewide universal pre-K, and expansion of services for infants and toddlers, in New York City, funding for childcare vouchers, among many others that we'll talk about a little bit later in the presentation. And this was obviously a huge win and kind of one of the spotlights of this budget, and really a reflection of many years of public pressure from advocates and parents and others throughout the state to help the state achieve or get closer to achieving universal childcare. Um, there are some other investments that we'll discuss throughout the presentation, but ultimately, other with the exception of kind of the early care and education space, we haven't seen the kinds of significant investments in children, families, and communities in New York that we at CCC really believe are essential for securing children's futures. And part of why we know we are maybe not seeing the full extent of investments we'd like to is the threat of massive federal funding cuts and policy changes. Among the most significant of these is legislation known as HR 1. This was passed in July 2025 by Congress, and it cut about 13.5 billion from New York State's healthcare system, as well as massive healthcare cuts across the country. And our own state has estimated that will result in about 1.5 million New Yorkers becoming uninsured. It also includes hundreds of millions of dollars in cuts to SNAP and adds about $170 billion nationally to immigration, detention, and deportation services and apparatus, which we have already seen, obviously, the massive harms that is having throughout the country. And these kinds of cuts not only threaten the specific programs that are being cut, but they require the state to fill budget gaps that the federal government previously filled, which really puts pressure on different programs throughout the human services sector, and really really limits the opportunities for expansion of services. So we have a lot of advocacy to do around not only mitigating the harm of federal cuts, but really recognizing that investing now is what we need to do to really ensure that we have positive outcomes for children and families. Another area we're obviously keeping an eye on is the city and state partnership. It's important to recognize that nearly half of New York's children live in New York City. Issues around youth justice, anti-poverty work, early care and education should be addressed in every county in New York State, including New York City. And with a new mayor, we have a new kind of evolution or opportunity for a city and state relationship. And we really saw that in the early care and education announcements and funding, where we saw investments not only across New York State, but in New York City specifically, and expanding a number of services there. We're also deeply aware of that the status of state funding affects the fiscal realities in New York City, so including the ongoing discussion around revenue raisers and what the state's approach to that will be. And finally, we know 2026 is an election year, so we're keeping a careful eye on every year how that can lead state leaders to support certain issues or oppose them. One area we were really glad to see was not included in the executive budget was any effort to roll back Raise the Age, which is New York State's landmark legislation that raised the age of criminal responsibility for young people. So our state would stop criminalizing them as adults. Almost every year we see threats of rollback, and we were very glad to see that it's not being proposed to be rolled back in the executive budget. And we'll obviously be monitoring that very closely and talk about that a little bit more later in the presentation. So with that very brief kind of policy context, we're going to go ahead and dive into different areas of CCC's budget priorities. I'm going to start in the area of health by talking about children's behavioral health. So CCC, as part of our statewide work, we help coordinate a campaign known as the Healthy Minds, Healthy Kids campaign. This is a statewide coalition of parents, of young people, advocates, providers, fighting to ensure that children have access to the mental health and substance use disorder supports they need, and that we can really respond to the behavioral health crisis facing children. And calling it a crisis is not an exaggeration. We know from studies that HMHK has conducted that only 1 in 4 children across the state are receiving the outpatient services they need. We know that from provider surveys, overwhelmingly, they report having massive children's wait lists, pausing intakes for services, families waiting for months or even over a year to get services. And we know when we delay care for children, this means they end up in emergency rooms, in hospitals, and inpatient settings. In fact, last year, the state settled a class action lawsuit acknowledging the state's failure to provide adequate home and community-based services to children. The state is now required to conduct an 18-month implementation plan and then actually roll out a series of reforms to enhance access to care. But the reality is children can't wait for the development of an implementation plan. Families are on wait lists now, children are in emergency rooms now, going without care, and the longer they go without care, the more complex their needs become. So for several years, CCC and the HMHK HK campaign have been seeking a $200 million investment in the children's outpatient system. This funding would allow us to reform outpatient behavioral health rates, which is really at the root of the capacity crisis. The reason we have wait lists is because we don't have adequate provider capacity. And a primary reason we don't have adequate provider capacity is the rates are so wildly out of sync with what's needed in order to provide care and create a retain and recruit a workforce able to meet the massive need in the state. So through this funding investment, we would be able to hire 1,300 additional professionals, serve 26,000 additional children, and hopefully reverse course on the direction the state has been going. Our second priority is focused on carving behavioral health services out of managed care. So since 2019, New York State transitioned to a system where our mental health and substance use disorder services for children's Medicaid are run through for-profit managed care companies. And this had already happened on the adult side. It happened on the children's side in 2019. But what we've seen is rather than improving care, we have seen a massive and chronic increase in payment delays and claim denials and administrative red tape. This has really stifled providers' ability to serve families because instead they're hunting down claims, they're navigating all this administrative barriers when they should be spending that time caring for families and children. And in turn, we see these for-profit companies are making hundreds of millions of dollars each year in profits off of a system that really seems designed to deny and limit access to care for children and families. So, we really feel it's past time to recognize the failure of the managed care system and remove the middleman. So we believe that we should carve behavioral health services out of managed care and then reinvest those savings into direct care and services for children and families, as well as the entire behavioral health population. So if you want to jump to the next page. I'm going to speak on one other item before I hand it over to before I hand it over to my colleague Ginny. So another area we are focusing on is returning back to the conversation around the really massive harms we're seeing from federal funding cuts. As I referenced earlier, HR 1 is leading to really significant healthcare cuts across the country in New York State. This includes limiting public health coverage option eligibility for a wide range of lawful immigrants. This includes refugees, asylees, victims of human trafficking, many of whom are currently getting their coverage through a New York coverage option known as the Essential Plan. Others will lose access through to their federally subsidized healthcare plans, the marketplace that was set up through the Affordable Care Act. And the bill also introduces things like onerous work requirements, more frequently eligibility certifications, other sort of hoops to jump through that are designed to knock eligible people out of coverage. And we know that not only will adults lose coverage, but children will lose coverage too. There's a very well established body of research showing that when parents are engaged in health coverage, so are children. When parents lose health coverage, so do children. So we're talking about direct and indirect impacts on children and families due to these cuts. So New York State has taken some steps to mitigate this harm. We are going to be, or have applied to transition from an essential plan back to the basic health plan coverage. I'm not going to go into a ton of detail on that, but what that would ultimately do is allow us to continue serving 1.3 million New Yorkers, but it would still leave about 450,000 behind. So we need to create state-funded options to cover those who are losing services, as well as other immigrants who are no longer eligible, such as DACA immigrants who were previously able to get care. And we also know we need to really support premium assistance to those who are losing their eligibility for financial assistance to purchase plans on the marketplace. So, all of these are combining to limit access to care. And then finally, because of all this new red tape being introduced, we really have to invest more in our community-based consumer assistance. So healthcare navigators, community health workers, those who are really there to help both engage and prevent the loss of coverage that is really part of the design of these cuts that we're seeing. So with that, I'm going to turn it over to my colleague Ginny, who's going to touch on some of our other healthcare priorities.
Thank you, Alice. So now we're going to pivot a little bit from children's behavioral health to early intervention. And as many of you know, the early intervention program provides critical evaluations and services to young children 0 to 3 with developmental delays and disabilities. Currently, New York State ranks 50th in the nation for timely delivery of EI services as a result of years of underfunding, leading to providers leaving the EI system. And what this results in is children waiting weeks, sometimes months, for the early intervention services that they need, or at times aging out of the early intervention system without getting those services. Now, a couple of years ago in the state 2024-25 budget, a 5% rate increase was included, but that rate increase hasn't been implemented yet. So CCC is part of the Kids Can't Wait campaign, which is a coalition of families, advocates, stakeholders, providers, advocating for changes to the early intervention system to make sure that children are getting the services that they need in the time that they need them. So one of our priorities and what we're urging the state to include in the final budget is to resource the early intervention system, to implement the 5% rate increase that was promised 2 years ago, and to also approve an additional 8% rate increase for all early intervention services. As I mentioned, the years of underfunding and inadequate rates have led to a lot of the providers leaving the system, which then leads to delays in services for young children, especially children in low-income communities of color. What we also want to do is kind of reimagine the early intervention system a little bit, strengthening it. Since its implementation in the 90s, the early intervention system has not had a comprehensive review. So we don't know we know what's not working, but we don't know what's working. We don't know um, how to make the system better, how to make the system work for more families. So what we want to try to do is strengthen that and identify how to make it more sustainable, more accessible, more equitable, and to make it work for these families statewide. So what we want to do is urge the state to fund a comprehensive review of the early intervention system. But we know that the early intervention system will continue to be unsustainable if we do not have a strong workforce behind it. So we want to grow and sustain the early intervention workforce, drawing new providers into the EI field by advancing a bill that is both in the Senate and the Assembly for an early intervention loan forgiveness program for professionals and individuals who want to work in the early intervention field. So, with that, I'm going to pivot a little bit from addressing health through early intervention to addressing health through food security. So, we know that children in food secure households are impacted positively with better physical and developmental health outcomes, improved academics, which includes better attendance in schools, better behaviors. They're able to concentrate more if they're not learning on an empty stomach, and better social emotional well-being. And we also know that SNAP is proven to be one of the nation's most impactful hunger relief programs, helping nearly 3 million New Yorkers, including a million children, afford food, which also makes it a critical tool for reducing child poverty and alleviating food insecurity. But as Alice mentioned, there are changes under HR 1 that are going to exacerbate food insecurity because of the changes to the SNAP program. And these changes will impact about 300,000 households that will either lose some or all of their SNAP benefits. Now, here at CCC, we're part of a bunch of anti-hunger coalitions. We're part of SNAP for All. We're part of the New York City Food Policy Alliance, urging the state to make these critical investments in food security to ensure that families, households, and children are no longer food insecure and have the healthy, nutritious foods that they need. So as a part of that, we're looking for an investment of $244 million for a food benefit program for New Yorkers who are currently excluded from SNAP based on their immigration status. And we're specifically focusing on 41,000 lawfully present immigrants who are going to be newly excluded from receiving SNAP benefits because of HR 1. And also including 65,000 households with children who are ineligible for SNAP because of their immigration status. Now, the 65,000 households with children is a recommendation from the Child Poverty Reduction Advisory Council, which was established by Governor Hochul in 2021. And this advisory council is tasked with developing, strategizing policies to reduce child poverty by 50% over 10 years. So reducing child poverty by 50% by 2031. And we're already kind of halfway there. So these investments are going to be critical to ensure that we meet that goal. Another priority we are advocating for is replacing existing SNAP EBT cards with more secure technology, especially the chip technology, to prevent theft for SNAP benefits. So SNAP theft or SNAP skimming has a devastating impact on families leaving them without a way to buy groceries. And sometimes many families don't even know that their SNAP has been stolen until they get to the registers at the grocery stores, at the supermarkets, and are ready to swipe their card. So we feel that this will hinder and decrease and minimize the SNAP thefts for these families. And just kind of a little bit of a fun fact or a tidbit, between 2023 and the end of 2024, New Yorkers received almost $51 million in replacement SNAP benefits. And that number could possibly have been higher, but many families didn't know when or how to report it. So we're also hoping that the state implements funding for replacement benefits while the EBT cards are upgraded. And we know, as I mentioned, with the changes to the SNAP program, that WIC is going to be even more important for households and families. And as many of you know, the WIC program is a federal assistance program that provides low income support to pregnant, breastfeeding, and postpartum women, along with children and infants under 5 with nutritious food, with nutrition education, breastfeeding support, and referrals to health services. So with this kind of negative impact to the SNAP benefits, we feel that WIC participation is going to increase. So we want to make sure that the state invests $30 million to help WIC with the possibility of more families applying. And with that, I'm going to pass it back over to Alice to talk about education.
Thanks, Jenny. So we, again, I know at the sort of top of the webinar referenced the really significant and many of its historic funding that was included in the governor's executive budget to expand early care and education access for children and families in New York State. And so, first and foremost, we really want to see those proposals included in the adopted budget. That includes a $561 million increase for pre-K. So that's both to expand universal pre-K statewide. There's still areas within the state that don't have universal pre-K, as well as provide funding for 3K in New York City to really sort of take those final steps we need in order to make 3K truly universal. The budget also includes funding for 2Care expansion in New York City. So aging down the system through beginning through some pilots to ensure that we have universal access to childcare for infants and toddlers. So this would not, the idea is that over time this would ultimately be available citywide, but would start through sort of targeted communities in New York, as well as funding for pilots in 3 other communities throughout New York State to really introduce some universal childcare pilots for children 0 to 3. And then the budget also includes $1.2 billion increase for childcare vouchers. So we strongly support all of these, obviously, efforts to expand pre-K and age down the system. The hope is really that introducing some of these sort of models based on universal childcare will be a model for the future. We really ultimately want a system where we don't have the barriers of proof of income or immigration status or all these sort of complicated hoops that really limit access to care broadly. And then the access to vouchers is really important in New York State because thousands and thousands of families throughout the state use childcare vouchers in order to secure free or affordable childcare options. And in recent years, we've had a massive budget shortfall for those vouchers. And what that has meant is that in New York City, for instance, we had 10,000 families on wait lists for vouchers by the end of last year, and another 33 counties throughout the state had closed enrollment and or started wait lists because there was inadequate funding to cover vouchers. So this is really kind of at crisis level. So to have had that $1.2 billion increase in the executive budget is a huge step in the right direction. That said, we know that 1.2 billion, as large as it is, may not be enough. And that still may not be enough to really make sure that we're tackling these wait lists and making sure that we're getting all families who are eligible the services they need, the childcare services they need. So we want to continue monitoring that amount and advocating for what's needed throughout the state. The one area where we really do see a lack of investment in the executive budget is in the workforce. So, really the childcare workforce is the backbone of service provision throughout New York State. This is a deeply underpaid workforce. It has been for years and years. It's comprised primarily of women of color, who are really providing the kinds of services that deserve and merit adequate pay. And this is not only a matter of equity, but it's also fundamental to if we really want a universal system. If we want to have a system where we are able to recruit and retain staff to provide services to children and fulfill this promise of universality, we have to pay this workforce adequately. And that includes both center-based providers, family childcare providers throughout the state. So we, join with the Empire State Child Care Campaign in advocating for a $1.2 billion investment in a state fund to increase childcare worker compensation. And the last piece I'll touch on the childcare piece is we really can't claim to be achieving universality if we continue to leave children with disabilities behind. And it's a story we see over and over again. We expand access, but at the same time, those children who are legally required and entitled to services are not getting the care. See this in special education as well as in across the childcare system. In May of 2025, for instance, New York City had more than 600 children waiting for seats for legally mandated preschool special education classes. We see programs throughout the state who are struggling to recruit and retain staff and teachers who can get better paying jobs in other places. It's time we reverse course on that. So there are a lot of different approaches we can take. One is to establish an annual rate setting mechanism for preschool special education evaluations and programs. This would mean we could actually increase rates at the same rate as public school funding, so we don't keep widening the divide between the opportunities and the workforce for preschool special education and for education for older students. But there's a lot more we can do in order to ensure access, and it's something that should be on the minds of all of our city and state leaders as we continue to think through how to expand ACE access. And with that, I'm going to turn it over to Caitlin, who's going to talk us through some of our priorities in the SAFE area.
Thanks so much. So in the around the issue, we can start with
Sorry,
housed.
start with
No, it's okay. We can start with the house. Thank you so much. So New York took an important step in addressing family homelessness last year by investing $50 million per year for a 4-year housing program pilot, but that still is not enough to address the need that we're seeing across the state. In New York, 2 out of 5 households pay more than 30% of their income towards rent, and 1 in 5 households pay over 50% of their income towards rent. This rent burden is not sustainable for people trying to stay in the state and to be able to afford other parts of the lived experience of being a New Yorker. A report from the New York State Comptroller Office highlights that the number of homeless children has also more than doubled between 2022 and 2024, increasing from just over 20,000 children in 2022 to now over 50,000 children in 2024. This same report revealed that 32% of New York's homeless populations are under the age of 18, and that's one of the highest shares in the nation. So with all of that in mind, we're asking for a commitment of $250 million for an inclusive statewide housing voucher program that we believe would have a transformative impact. It would help nearly 13,000 family households statewide. And according to the New York State Child Poverty Reduction Advisory Council, a statewide rental assistance program would available to all unsubsidized renting households below 50% of the area median income would reduce child poverty by 15.7% over the next decade. So that is just something we think is very important because right now we're seeing so many New Yorkers at risk of eviction, and this housing voucher program could really stabilize that population. And we also just believe that homelessness should not exist full stop, but especially not in the wealthiest city in the wealthiest country in the world. And youth homelessness on top of that is even more unacceptable. And unfortunately, the runaway and homeless youth population in New York State is facing immense barriers to getting support. And so we have an ask this year of a $22.1 million to increase the number of beds, the bed rate that providers are paid to offer those beds, and to increase supports for mental health programming and specific shelter supports for LGBTQIA plus youth. If we're able to achieve those goals, we'll be able to have a more stabilized families going forward. Now, when we move to Every Child Safe, we have both a youth justice and a child welfare focus. So starting with the youth justice space, as Alice mentioned in the beginning of this presentation, we were worried about having raised the age rollbacks in the budget this year because it had been brought up a lot by different DAs. And it's an election year, so being harder on crime is typically how the election years go. But we were really grateful to see that not only was there no mention of a rollback of raise the age in the executive budget, but over 220 organizations from across the state signed on in support of the coalition to protect raise the age. And I think that just shows how strongly this state believes in making sure young people are able to get the support they need. And as a reminder, Raise the Age passed in 2017. It was a law that both ended the archaic practice of incarcerating 16 and 17-year-olds with adults, but also devoted $250 million a year to support counties with prevention programs, alternatives to incarceration, reentry support, and detention. But since the passage of the bill, over $1 billion has been appropriated to counties, but only a third has been spent. And of that third, the majority is on detention. That was not the promise of Raise the Age, which was supposed to be both stop incarcerating youth, but also get youth into programs that would be supportive of their development. So the Coalition to Protect Raise the Age is pushing for the Youth Justice Innovation Fund, which would devote $50 million directly to be accessible by community-based organizations through a grant process, and would only fund prevention programs, alternatives to incarceration, reentry, positive youth development models, all the programs we know that are proven to work to support young people. And they would be available for young people ages 12 through 25 and would be accessible for all counties, including the city of New York. New York City currently cannot access Raise the Age funding. So the Youth Justice Innovation Fund would allow for the city to be able to have money to support their programs. And around 50% of the young people who are justice involved live in the city. So it's an equity issue to make sure that we are getting support to support our young people. Additionally, we would like to draw your attention to the issues of suspensions in New York State. New York City has made slightly more progress than the rest of the state, but there is still so much work to do. Across New York State, students as young as 4 can be suspended, and suspensions can be as long as 180 days, which is the whole school year. And suspensions typically are due to behavior because of an unresolved trauma, something that could have come up at home, maybe a reading disability. There could be a whole spectrum, but it also can be as benign as skipping class. And so we are really living in a time where this is not the education system that our young people deserve. And then suspensions are also completely disproportionate. We see Black students, students with disabilities, LGBTQIA plus students, students from lower economic backgrounds are all more likely to be suspended than their peers. And in fact, in the 2022-2023 school year, over 137,000 students were suspended across the state, which included over 8,000 students in pre-K to grade 3. Those are 4 to 8-year-olds, and that is the most pivotal part of our education, is that where they get that foundation, not only in educational basics, but in the social emotional learning, the ability to have connection. It's a pivotal time for our youngest learners to be in school, not suspended. Those students, together, they have lost almost 1 million days of education in 1 year alone. And over 9,000 students were suspended for 20 or more days cumulatively. That's a month of school. So I really don't understand why we are unable to make sure that our students are getting the education they deserve. So in passing the Solutions Not Suspensions bill, it would reduce reliance on suspensions. Nothing will get rid of suspensions in this bill, but it would allow school communities to have benchmarks before we get to a suspension in order to support our students more. Oh, all right, moving on to child welfare. We know this is sort of like a cumulative result of what we have seen throughout this whole presentation, is that decades of research and countless studies show that poverty is a driving instability for families. And a study by CCC on the state of prevention service providers in New York City also shows that if we invest in upstream prevention and services, we can help avoid allegations of neglect due to unmet basic needs for families. And that includes investing in things like housing, childcare, cash assistance, everything you've seen in this presentation. If we invest in those and meet those needs, we're going to see more stabilized families, because poverty is not their fault. It is a policy choice that we continue to make, and we need to change the rhythm of that decision. So if we truly want to support families, then there must be a stabilizing effort, because the way our system is right now, things are too expensive. So to address this, CCC and partners are pushing for the Child and Family Wellbeing Fund, which would devote $30 million to grassroots organizations and community-led projects that would support families, reduce child welfare involvement. But it would, most specifically, the organizations and projects funded will have no connection to the Child Protective Service system, which plays its own role in making sure families are okay. But we really think that if we strengthen upstream investments outside of the Child Protective System, families will have safe places to go if they need help without worrying about opening a case, or furthering their engagement in the system. So we are really excited about that investment and really grateful for our partners who have been pushing this as well. And then finally, talking too fast, just getting excited. Finally, we want $10 million for the Fostering Youth College Success Initiative. College is expensive. Everything right now is expensive, but we know if you are from a foster care background, a lot of your financial support is just not there. And so the Fostering Youth Success Alliance, FISA, has been pushing and asked for $10 million for a while now. And we really think it's past time to ensure that students who have foster care experience have some extra financial support outside of tuition, because we know textbooks, food, being able to go on a class trip. These are all things that are instrumental in a higher education experience. And we want to make sure that they are able to have those opportunities as well. So, all right, I got really excited and spoke too fast at the end, but I'm really grateful that you all are here, and I'll pass it back to Alice to move us along.
Thanks, Caitlin. Believe it or not, we all spoke among ourselves about the need to slow down, and yet we all get excited about these issues because we all care a lot about kids and families and these. And there's also a lot of territory to cover, as you can tell. So, again, we have, I know throughout this presentation, there have been opportunities being shared on the side for e-actions. We'd first and foremost say sign up for, if you're not already, sign up for CCC Listserv. That's where you can learn about action opportunities, things as they come up. It's also, if for those of you who are in the city and also doing city advocacy, you know, that is starting to ramp up as well. So we'll be having opportunities to engage at that level as well. You know, there have been some advocacy days throughout sort of January and February, and there'll be more to come. So if you see one, it's a great opportunity if you've never participated to meet with your elected leaders to really fight and advocate for the issues you care about. There are take action opportunities like the e-actions being shared, but also more opportunities to come around call-in days and opportunities to reach out directly to legislators. And always feel free to contact your local representatives and uplift key priorities, whether that's in person or on the phone. Every action helps at this stage. So I think at this point, we are going to go ahead and take some questions. I think we had some that were included in the chat. I'm going to start off with the one that Judy raised on the EI rate increase. I'm going to hand it to Ginny to kick us off with that question. Ginny, would you just read the question for those who can't see it first?
Sure. Thank you, Alice. Give me 1 second. So Judy's question was, the 5% EI rate increase was promised. How was that different than budgeted and required? Ooh, okay. So back in 2024, 2025 state budget, the final budget included a 5% increase, a 5% provider rate increase for early intervention. And I failed to mention, but it also included a 4% modifier for underserved and rural communities. Now, in order for the state to be able to get that funding for the 5%, they had to submit a state plan amendment to the federal government, to the Center for Medicaid and Medicare Services. Unfortunately, that state plan amendment was submitted at the end of 2024. I believe it was December 2024. And the state plan amendments and the implementation of the state plan amendments can be done on a quarterly basis in the quarter where it was submitted. So even though advocates and everyone was happy that we were able to get a 5% increase that we hoped would have been starting April 1st of 2025, when the state plan amendment was submitted in December, the 5% would have been retroactive to October of 2024. And we are still waiting to hear back from the federal government to approve the state plan amendment for the 5% increase. The good news is that the 4% increase was approved by the federal government and it's in the early stages of implementation. However, that is just a small amount of funding for EI providers, and we really need the 5% to be approved and implemented, which is why we're asking the state to implement that 5% as we are awaiting for approval from the federal government. And we know that 5% isn't a lot, but it is a start to at least help early intervention providers with costs associated with the services that they provide. And we're hoping that with an additional 8%, that can also go a long way to ensuring that the providers, the therapists are able to continue to provide the services to children in a timely manner. And I hope, Judy, that that answers your question.
Thank you, Jenny. As with many things, the promise of something or even a legislation isn't always a guarantee that it happens. So a lot of the advocacy work is in monitoring and implementation. And this is definitely one of those places where, providers and families were promised a 5% increase. Providers made decisions based on thinking there would be a 5% increase and there would be more funding in the system to sustain a workforce and to provide more access to families. And that promise has not been fulfilled. And that's a real injustice to children and families who have been waiting for so long to get care. And many of them are aging out of the system. It's only available to children birth to 3. And those are children who might end up needing special education services because they're not getting care early. So every one of these investments is important. There's another, so I'm going to pivot to another question. And Caitlin, this one's for you. I don't know if you can see it or not, but there's a question about the Raise the Age funds are not being spent, or the Raise the Age funds not being spent. Are they not being used at all, or are they being redirected to other programs?
That's a great question. So when Raise the Age was passed as an appropriation, so there is no Raise the Age bank account where there's $1 billion sitting. It's if a county submits a plan and the plan is approved, then that money will have to be made available for that county. So when with the $1 billion, it's not necessarily being, in a way, I'm supposed it's being redirected to other cost savings that the state has to make, but it's not necessarily going to like other youth serving programs. It's just not there. It's a dry appropriation is what they call it. It's so I hope that helps your question. There's a reappropriation of the funding every year of the amount that was still present at the end of the budget season.
Thanks, Caitlin. We also have a question. It's a little bit longer, but it's about what's being discussed on prevention services like mental health aid first training, the use of community health workers, early childhood hubs. There's a shortage of healthcare professionals and a need for more paraprofessionals. Billing services for community health workers is not sufficient. It's cumbersome. How do we get the state to mandate a percentage of hospitals to provide a community benefit towards community health improvement section of their 990? There's a lot in that question. I'll confess, I think some of that is coming from, it sounds like a hospital perspective, which is less my area of expertise. So I think, I'll say that CCC and the Healthy Minds, Healthy Kids campaign focus. There's so many areas that we could talk about investment needed in children's mental and behavioral health services. And where we've really chosen to focus our attention in recent years is on the outpatient system and the sort of statewide need to enhance reimbursement rates for clinical services, for mental health and substance use disorder services, and for home and community-based services, because we really view that as really the prevention, where we prevent the need for more, for the escalation of needs later in children's lives. But that doesn't mean there aren't so many other areas where investments are needed, including all the areas referenced here, like, really, pushing in paraprofessionals, ensuring that hospitals are, better hubs for services. Community health workers are so important for so many different services. And once you put them through Medicaid, it can become more challenging. So I think those are all important issues to flag. I think at the end we'll share our contact information. So whoever included that comment, feel free to reach out to me and be happy to discuss more. I think some of that work is likely happening more locally in different hospital systems who are trying to figure out internally how do we untangle all these different pieces. So happy to maybe have a offline conversation about that, and kind of see where there may be some space for those investments. I will say in terms of the mental health first aid, there's actually year to year, that's one of the few areas where we do see in the last couple of years some pretty significant investments, both youth mental health first aid and mental first aid more generally. But I think a lot of our focus has been on the outpatient system more broadly. Those were the questions I saw, but I don't know if anyone else had. I see that Abigail shared Children's Aid's and FICE's action alert for the Investment in Foster Youth College Success Initiative. Thank you for sharing that. Any other questions or items people want to share? Oh, Marcy, I did not see your question. Let me see if I can find it. Give me a moment. Let's see. So I did see your comment about the effort to extend loan forgiveness programs for EI service providers. And yeah, I mean, this is definitely a concern as you raised because the feds are, as some folks may know, are removing a lot of the licensed providers from the professional category, which is so important for getting loans for higher education to enter different professions. There's been a concerted effort to limit what's considered a professional category, and that obviously has, for those who need to, especially for those who need to take loans in order to get higher education, that's a massive barrier. So I think things we can do at the state level to encourage people to enter this field are really important. So I think it's a good flag that these things are more important than ever in light of the federal context. Any other questions or comments? Okay. So I think, actually, do you want to jump to the next slide just so we can share our contact information with everybody? Our slide clicker may be off right now. I'll share my email address in the chat. Oh, there we go. Thank you. This is our contact information for myself, Ginny, and Caitlin. Please feel free to reach out to us. Like we said, we've still got ways to go on state budget advocacy, but also city budget advocacy. And we look forward to engaging. And Marcy, the question about what you can do to engage in the absence of so in some years, we have a advocacy day that's focused on all of CCC's priorities, and other years we focus more on our coalition and campaign work. There will be some upcoming advocacy day opportunities focused on specific issues. So an example of that is there's a family empowerment day that our partners Families Together New York State lead in March, and that will have a portion of that will really be focused on behavioral health. A portion of that will be focused on youth justice and solutions, not suspensions. So CCC will be up advocating on that day. There are a couple of, especially if there are any young people who want to engage, there's a couple of youth justice opportunities coming up to visit at the Capitol. Call-in days and campaigns and things like that.
Alice, you're
So
breaking up a little bit.
really just encourage folks to stay to close out. Oh, I'm sorry. Go ahead, Jenny.
You were breaking up a little bit, so I don't think people were able
Oh,
to
I'm
hear you.
sorry. Sorry about that. So I was just saying that there will be some, I think I mentioned Family Empowerment Day. Hopefully folks heard that in March. Okay, great. And then just that stay tuned on the listserv. We'll have lots of opportunities for engaging in different ways and contacting your elected leaders. All right. Thank you all so much for joining, and we look forward to being in touch in the coming weeks.
Thank you.
Well.